to welcome everyone. Thanks so much, Sean, for agreeing to do this. And I just wanted to real quick put the contact information for Patient Central so that people have it as they're watching this. If you realize you have a question or something that you want to talk to someone like Sean about, the phone number is there on the screen, as well as an email address if email makes you more comfortable. So please note that down. We'll also have it at the end of the presentation, but that way you can reach out and get that personalized one-on-one support. So I will go ahead and stop sharing now and give you the ability to share, Sean.
Let me see. Okay, can everybody see that?
Looks good on my end.
Okay, I'll just get into it. Yeah, again, my name is Sean. I'm a manager here at our patient services program. So this lecture is on, or webinar is on diet and nutrition for pancreatic cancer patients. So I'm just going to talk through a few different points. So provide a general overview of dietary recommendations for patients. I'm going to talk about exocrine pancreatic insufficiency. I'll talk a little bit more about some of the common nutritional challenges that pancreatic cancer patients face in management strategies, and also touch on the importance of working with the dietitian. And I think if we do have time for Q&A afterward or have any questions, I'd be happy to answer those. Just noting that I myself am not a medical or nutritional professional, just can't provide medical or nutritional advice or recommendation. Let me see here. Okay, and I just wanted to start by going over some of the different functions of the pancreas. So there are two main functions. The first main function is of the pancreas is to create enzymes that aid in digestion of fats, carbohydrates, and proteins. So kind of, as you can see on the diagram on the left, the pancreas, that's that big yellow thing in the middle. The pancreas secretes those enzymes that go down the pancreatic duct into the duodenum, which is the first part of the small intestine. And that's where the enzymes, as well as bile from the gallbladder, all meets in order to aid in the digestion of food. The second function of the pancreas is to produce insulin and glucagon. So these hormones work together to maintain proper levels of sugar in the blood. Insulin decreases the amount of blood sugar in the blood, and glucagon would increase the amount of sugar in the blood. So for pancreatic cancer patients, many of them do encounter or face some different nutritional challenges after their diagnosis. And really the nutrition goal for patients with pancreatic cancer should be to consume an adequate amount of fluids, calories, proteins, vitamins, and minerals each day to maintain a desirable weight and activity level. Some of the primary goals of these dietary changes are to prevent or reverse poor nutrition, to maintain dose and schedule of cancer treatments, to manage symptoms, and to maintain or improve weight and strength. So these are some general dietary recommendations for pancreatic cancer patients. In general, it's recommended to try for 6 to 8 small meals and snacks a day. This can be sometimes more easily tolerated for patients versus 3 or 4 larger meals. Choosing lean sources of meat, so things like chicken, turkey, and fish over red meat. Staying hydrated, so 6 to 12 cups of fluid each day, as well as eating healthy, high-calorie foods such as avocados, olives, and nuts. Some examples of healthy eating recommendations include 6 to 8 or 5 to 6 ounces of protein a day, and up to 3 cups of dairy products, 3 to 6 ounces of whole grains, including bread, cereals, and pastas, 2 to 6 servings of vegetables, 1 to 4 servings of fruit, as well as 5 to 6 teaspoons of healthy, high-calorie, high-fat foods. And again, those would be things like avocados, olives, and nuts. So for patients with pancreatic cancer, there are some foods that may cause overall discomfort and could be things that a patient may benefit from avoiding. Those would include high-fat foods that may be harder to digest, vegetables in the cabbage and onion family, as they may cause excessive gas in patients, spicy foods, refined and simple carbohydrates. So that would include things like white bread, desserts, or just other foods with a lot of added sugar. High fiber foods, milk and dairy products if lactose intolerant, as well as caffeine. And as I mentioned in my first slide, one of the main functions of the pancreas is to produce pancreatic enzymes that aid in digestion. However, some pancreatic cancer patients do face pancreatic insufficiency, and that is the inability of the pancreas to make or secrete the enzymes needed for digestion. So this is a very common problem for pancreatic cancer patients, and insufficient enzyme production could be related to either the cancer itself or to potential treatments. For patients that undergo pancreatic surgery, typically when they undergo the procedure, part of the pancreas is removed, and in some cases, the remaining pancreas may not produce enough enzymes to aid in digestion. So again, that is one cause of potential insufficient enzyme production. But even for patients who do not qualify for surgery, if the tumor obstructs that pancreatic duct that we saw on the first slide, that could inhibit the ability of the pancreatic enzymes from getting to the small intestine. So again, another potential cause of pancreatic insufficiency. So these are some of the symptoms that patients with pancreatic insufficiency may face. That includes feelings of indigestion, cramping after meals, large amounts of gas, foul-smelling gas or stools, floating, greasy or fatty stools, light-colored yellow or orange stools, diarrhea, or unexplained weight loss. And these are all symptoms if a patient is experiencing. We definitely would recommend them to consult with their doctor or dietitian to discuss if they are potentially caused by pancreatic insufficiency. So when the pancreas is not producing enough enzymes to aid with digestion, pancreatic enzyme products are needed. At this time, there are 5 prescription pancreatic enzyme products on the market, and that includes Creon, Pancrease, Pertsai, Viocase, and Zenpep. And patients should consult with a doctor or dietitian to determine which pancreatic enzyme product may be right for them. Another important thing to note is that there are over-the-counter pancreatic enzyme supplements that are available without a prescription. However, since they are designated as dietary supplements versus drugs, they are not regulated by the FDA. So while their manufacturers are responsible for ensuring the safety of their product, it does not have the same manufacturing consistency from batch to batch as FDA-approved prescription enzymes. And for that reason, those over-the-counter enzyme supplements are not recommended for pancreatic cancer patients. So for patients that do receive pancreatic enzymes, it is important to work with the doctor or dietitian to determine the appropriate dosage. Most people start by taking 10,000 to 20,000 lipase units with snacks and 20,000 to 40,000 lipase units with meals. Some doctors may suggest that a patient could, from there, increase the amount of pancreatic enzymes that they take with meals and snacks until they are no longer experiencing symptoms of pancreatic insufficiency. However, there is a max, so patients should not exceed 2,500 lipase units per kilogram of body weight per meal, and that's assuming 4 meals per day. So for example, a person that weighs 150 pounds or 68 kilograms could safely take up to 170,000 units of lipase at one meal. And again, it's just important to discuss this with your doctor or dietitian at regular visits. In addition, the 5 prescription pancreatic enzyme products are not identical. So if one enzyme is not working or providing relief to the symptoms of pancreatic insufficiency, it may be helpful to ask with the doctor if another type of pancreatic enzyme could be beneficial. And there are some different strategies in order to obtain the best results from pancreatic enzymes. So for one, when taking multiple enzymes, it may be beneficial to take some at the beginning of the meal and the rest at various points throughout the meal. Typically, if a patient forgets to take their pancreatic enzymes with their meal, it's not recommended that they take it at the end or trying to double up for the next meal. It is important that they try to take them at the beginning. And then again, if multiple, at various points throughout the meal. So patients can swallow the intact tablets and capsules with liquid at meal times. However, if swallowing a pill is difficult, a patient could also open the capsule and add its contents to a spoonful of soft food, something like applesauce that does not require chewing. Pancreatic enzymes may have reduced effectiveness if taken at the same time as iron supplements and antacids. So that's the thing to keep in mind. Additionally, it's encouraged to use these products before their expiration date. Otherwise, they may lose their effectiveness. The doctor could also prescribe an acid-reducing medication to help improve the effectiveness of pancreatic enzyme products. So for patients that do need pancreatic enzymes, one thing that we do hear sometimes is that they may encounter financial struggles in affording those products, and insurance coverage, including Medicare, may vary for pancreatic enzymes. But in these cases, there are a few steps that a patient can take. For one, some insurance companies will have one preferred brand for which there is a lower copay amount. So a patient could check their prescription formulary and again, check to see if maybe there is a preferred brand that is at a lower cost. Each prescription enzyme product also has an associated patient assistance program to help cover the cost. So this is something that a patient can apply to if they meet the criteria outlined by the manufacturer to potentially receive assistance. If a patient is on Social Security, they can also apply for the Social Security Extra Help Plan for additional assistance. And something that we do recommend to patients as well is working with the social worker at their hospital if possible. And the social worker may know of additional programs for the patient, including potential government programs or even more local programs. And now I'm going to switch gears a little bit and get into some of the common nutritional challenges that pancreatic cancer patients may face. So the first one is loss of appetite. And loss of appetite could be caused by surgery, prescription drugs, or the cancer itself, which can decrease the patient's appetite or change the way food tastes. There are some strategies to help manage loss of appetite in patients. The first one being scheduled meal times and meal planning. So this entails just not waiting for the patient to get hungry themselves or until they develop an appetite themselves, but pre-planning and scheduling out these meals for patients could be helpful. Another thing that could be helpful is medical nutritional supplements. So drinks like Ensure, Boost, Carnation Breakfast Essentials. And for patients that have diabetes, there are special or designated drinks, things like Glucerna and Boost Glucose Control that could be helpful for them. Another thing that could be helpful is by placing small bowls of nutritious snacks, so things like nuts and fruits around common spaces in the house. And that's just to encourage patients to snack between meals. Another thing that could be helpful is perking up the taste and smell of foods with things like herbs and spices. For high protein foods, things like cheese, tuna, chicken, ham, and egg salads, in some cases, it could be better tolerated or more appetizing to patients at room temperature. So these are things that you could take out of the fridge an hour before, let them get to room temperature before consuming, and again, could be more appetizing for the patient. There are also medications that can stimulate appetite. That includes Megace, Marinol, steroids, antidepressants, which have increasing appetite as a side effect, and also antiemetic drugs or anti-nausea drugs, which could work to increase appetite if the patient is experiencing feelings of nausea. Another common side effect or common nutritional challenge for patients is weight loss. And weight loss can be caused by a number of factors, including side effects of treatment. The cancer itself can cause a patient to consume fewer calories than the body needs to maintain. And again, that could be through various methods, things like loss of appetite, taste changes, or even nausea can encourage a patient or discourage them from eating. Cancer cachexia is another potential cause for weight loss. It's also known as tumor-induced weight loss. It's a complex problem and it affects the way the body uses calories and protein. So it can cause the body to burn more calories than usual. It can also break down muscle protein and can also decrease appetite in patients. And if a person is consuming regular meals and snacks but is losing weight, he or she may benefit or may be experiencing cancer cachexia. Some additional tips for managing weight loss include restricting or avoiding foods that cause diarrhea, using medications for appetite stimulation, maintaining adequate hydration, incorporating light physical activity, consulting with a dietitian, and we'll get into that a little bit later as well, but consulting with a dietitian is something that we recommend for all patients to help address any nutritional challenge they are facing, and also getting plenty of rest could also be helpful. The next nutritional challenge I'm talking about here is diarrhea. that is a condition marked by abnormally frequent bowel movements that are more fluid than usual. And often healthcare professionals would characterize diarrhea as 3 or more loose stools per day. So again, this is a common side effect, and it also could be caused by a number of different factors, including lactose intolerance, bacterial infection, damage to the intestinal wall, hormone-producing tumors, and that includes certain types of pancreatic neuroendocrine tumors, which are a little more rare of a tumor type, but again, could be a potential cause, inflammation or ulceration of the bowel, pancreatic enzyme insufficiency, as we discussed earlier, could also cause diarrhea, and also certain treatments and medications could cause it as well. In order to cope with diarrhea, there are both over-the-counter and prescription medications that could be helpful, and it is also could be a benefit to a patient to consume foods with more soluble fibers, including things like oats, applesauce, and bananas. A patient can also experience taste changes. It could be caused by oral infection or zinc deficiency, and usually a doctor would want to rule those things out before kind of continuing to discuss what else may be of cause. Another thing that it could be caused by is platinum chemotherapies. One of the most common treatment regimens, or a standard of care treatment regimen for pancreatic cancer patients, FOLFIRINOX, includes a chemotherapy oxaliplatin. That would be a platinum-based chemotherapy, and again, could potentially cause taste changes. Some suggestions to improve taste of food include using plastic cutlery over metallic cutlery, sweetening foods that are overly salty. Also, general oral hygiene is helpful, but also a mouth rinse of baking soda, salt, and water could help. And another thing that's maybe helpful for a patient is just trying different types of foods, and even foods that were previously disliked. Even if a patient has foods that they previously found more appetizing that become less appetizing, with those taste changes, even previously disliked foods could be a little more appetizing to them. So it's something to keep an open mind about and potentially consider for a patient. The next nutritional challenge here is constipation. Constipation can also be caused by cancer or cancer treatment, but also by pain medication. When a patient is experiencing constipation, they may benefit from foods with insoluble fiber. So those would be things like whole grain foods, nuts and seeds, flax seeds, and vegetables, including green beans and cauliflower. It could be helpful for those patients to drink plenty of liquids and also discuss the dosage of medications with their doctor. So like I mentioned before, pain medications could cause constipation, and even pancreatic enzyme products, if they are taken in excess or a patient takes too much, those could cause constipation as well. So again, it's important to work with the doctor to determine the cause of constipation and then the most appropriate management strategies. The next nutritional challenge we have here is nausea and vomiting. Some ways to help address nausea and vomiting include eating small, frequent meals of easily digestible food, things like rice, broth, or soda crackers. And it's important to note too that if a patient has too much food or has too full of a stomach, that can contribute to feelings of nausea. But on the other side of things, it is also important to keep a little bit of food in the patient's stomach at all times. An empty stomach can also contribute to those feelings of nausea. Things like crackers, dry toast, peppermint, or ginger tea may be better tolerated, as well as there are antiemetic or anti-nausea medications that could also be an option. And at any point, we just do encourage patients to work with a doctor in order to, a doctor or dietitian to help manage any nutritional challenges that they're facing. And so now I'm going to kind of get into some dietary changes that follow following surgery. So if a pancreatic cancer patient's tumor is so localized to their pancreas, surgery is a potential treatment option. Some short-term dietary changes are if the patient has a J-tube, feeding will initially be provided around the clock and will eventually be cycled to only nighttime. They may start on an oral diet with clear liquids and advance to solid food. Some of those short-term changes include eating small, more frequent meals, avoiding greasy and fried foods, and also initially limiting the consumption of raw fruits and vegetables. Some long-term dietary changes include the patient needing to avoid or limit fried, greasy, and high-fat foods or eat them in smaller quantities. consuming fat as tolerated from healthy sources such as olive oil, canola oil, peanut oil, nuts, seeds, and avocados, aiming for at least 2.5 cups of fruits and vegetables per day, taking pancreatic enzymes if needed, taking acid-reducing medications as prescribed, and again, those can increase the effectiveness of pancreatic enzymes, and also some of those long-term changes after surgery. Something that may be helpful is engaging in physical activity for at least 30 minutes per day. And under the advice of a surgeon, weight training may also be considered. So for any pancreatic cancer patient that's experiencing nutritional challenges, we do encourage them to work with a registered dietitian. A registered dietitian is a healthcare professional who can help manage the side effects of treatment that affect the patient's ability to eat well. Registered dietitians can also help with questions about the role of diet in cancer care and cancer prevention. And a dietitian or nutritionist, specifically one who is familiar with cancer patients, would best be able to evaluate each patient's needs and help design a diet that is best for them. So for a patient that is, if a patient is looking for a dietitian, there are a few ways that they can go about that. So they can ask their oncologist for a recommendation to one. They could also contact the local hospital or cancer treatment center and inquire about dietitians there. There are also a few online resources that could be helpful. The first being the Academy of Nutrition and Dietetics website, eatright.org, which has more information on how to search for a local dietitian. And they have a search engine that patients can use as well, where they can enter in their zip code and select a specialty. So selecting cancer/oncology nutrition to find a dietitian near them. There's also the Commission of Dietetic Registration, and they have a list of board certified specialists in oncology nutrition by state. And that's a certification that's provided to certain dietitians that work more than 2,000 hours in oncology nutrition and also pass a written exam. And one other thing that could be helpful is by contacting Patient Central. We do maintain a listing of pancreatic cancer specialists, including some dietitians around the United States. So we are here to help and can help locate dietitians near you. And that's all I had for today. I just wanted to kind of take the time to put another plug here for Patient Central. All the information that we discussed today is included in our diet and nutrition booklet, which is a free resource that we can provide to patients, caregivers, or loved ones. Either we could send them a free copy via postal mail, as well as a digital copy if requested that way. We also have information on topics outside of diet and nutrition, so things like treatment options, symptoms, risk factors, clinical trials are all topics that we can discuss. And on the right there, I just included our contact information. And we are open from Monday through Friday. So if anyone has any questions, they can always feel free to reach out. And that is all that I had for today. I'm going